Dr. Curry, before the break, you were talking about some of the factors that you considered in determining that Ms. Heard suffers from personality disorders. And one of them, I think the last one you said before you left, was self-report. What do you mean by that?
So the self-report would be things that Ms. Heard indicated to me specifically. So there were a couple of characteristics that she noted in her self-report that were consistent with these personality disorders. The first was actually my own behavioral observations of her based on her self-report. So one of the hallmark characteristics of histrionic personality disorder is sort of a overly dramatic presentation. We call this impressionistic speech. So it tends to be very flowery. It uses a lot of descriptive words like magical, wonderful, and it can go on for quite some time, and yet it really lacks any substance. So at the end, you're left wondering what was just said or what the answer is to the actual question. So that occurred a number of times. And it also represented the quick shifts you'll see between emotions. So she would suddenly be one way, and then she would become very animated or very sad. And when people are displaying these emotions with this personality disorder, there's a sense of shallowness to it. People who are observing them will feel like it's almost play acting, and they might not be able to put their finger on it. But part of it is because of the rapidness with which the person can switch emotions, and also the lack of substance. They don't really refer to, I feel this way. They might describe emotions, they might describe events, but very rarely, and Ms. Heard did not say, I feel vulnerable. She never really indicated a vulnerable feeling of her own. Then the substance of her self-report. So when I was asking her information about her history.
We're going to ask more about that later. I was just trying to get a sense of what a self-report was.
Oh, okay.
What psychological tests did you perform?
Okay, so psychological tests, I'll just go in order. So first of all, I asked her a couple questions from something called the mini mental status exam. That's really just a fancy way of saying that I wanted to make sure that she was alert and oriented to, we call it person, place, and time. That means she knew who she was, she knew who I was, she knew where we were, and she knew the date. That way I can ensure that she's able to participate in the evaluation and understand what's happening. I then administered something called the Minnesota Multiphasic Personality Inventory 2. The 2 means that it's the second edition. And this is something we call an objective measure. So it asks 567 questions, more statements, and the person either agrees or disagrees with them, how much the statement represents them. And this test has been around since 1943. There are more than 10,000 studies showing that it is appropriate for determining somebody's personality traits. It measures all of those things I sort of mentioned, how a person thinks, feels, and behaves in multiple different aspects of their lives. It also measures very accurately any signs of mental illness or dysfunction. And the reason I also really like this test, whenever you're using a test for an evaluation that's going to be used in a forensic setting, people have a lot of incentive to present themselves in a way that's going to benefit their case. And they may want to look like they're sicker than they really are. They may want to look much healthier than they really are. And some of those incentives, they may not even realize that they're intending to do that. So it can be conscious or unconscious, but you really need to have a test that can check for that. And the MMPI-2 has a set of validity scales, we call them. These are scales that measure really the truthfulness and accuracy with which a person is approaching the test. And these scales on this particular test have been so well researched over many decades that they've become very nuanced, and they can tell us a lot about if somebody's, for instance, exaggerating. Are they elevating one of the scales that shows that they're exaggerating on purpose? Are they exaggerating in a manner that's more like a cry for help? Are they exaggerating in a manner that's clever and sophisticated or more obvious? And then the same exact thing goes for trying to minimize symptoms. We have a number of scales that can show us all the different, if somebody's trying to say they're the most wonderful person on earth, or if they're just trying to deny problems, and if they're doing that again in a very clever way or more of an obvious way. So that test was my choice for this case. There's one other reason I'd like to add, is that part of my evaluation was, one of the reasons was to assess whether Ms. Heard has post-traumatic stress disorder, which I told you about earlier, as a result of the incidents that she's alleged occurred by Mr. Depp. And that's a really tough disorder to find out if somebody's faking it or not. It's one of the most easily faked disorders. Most of us know what it feels like to feel anxious. And a lot of people have seen war movies and movies that depict somebody having PTSD. In fact, some research has shown that if you give someone a diagnostic checklist and said, show that you have PTSD, they can do it 96% of the time, just someone on the street. So you really need a test that's very sensitive to that. And the MMPI-2 has been shown in multiple studies to be excellent at detecting those attempts.
Okay, you keep using MMPI-2. That's the abbreviation that you folks use for?
I'm sorry if I hadn't said that. That's the Minnesota Multiphasic Personality Inventory.
Okay. What other psychological testing did you perform?
So I also performed the clinician-administered PTSD scale, -5, and that -5 links it to the diagnosis for PTSD in our current diagnostic manual, the 5th version. To do that test, you first administer something called the Life Events Checklist. And the Life Events Checklist, both of these tests, by the way, were developed by the National Center for PTSD with the Department of Veterans Affairs. But the Life Events Checklist lists 16 different very stressful life events that people can go through that are often can be associated with developing PTSD. And then it also has a 17th item that you can fill in if you feel like you've been through something really difficult that wasn't included. Now, I like to also add something called the Life Events Checklist 5 interview, which digs a little bit deeper into the person's childhood as well to find out if there's so many different things that can be difficult growing up. And also, it's very important that you have the person determine which of the events they've listed, let's say they have a number of different types of traumas, which one do they feel like was the most traumatic for them? Which one still causes them to feel distressed when they talk about it? And sometimes they can't just identify one. And then that leads to your next decision. So if they have multiple different similar types of events, like seeing combat, then you might use that as the worst one, the multiple similar. So that looks like you describe an anchor, we call it, to do the testing, and we would maybe describe the anchor as the worst of my combat experience, okay? Now, if somebody had multiple different traumas from different times in their life, like childhood abuse, and then went to combat and had some horrible things happen there, you would do the clinician-administered PTSD scale test, the one that comes after. You do one for the childhood event and a separate one for the adulthood event.
Does this clinician-administered PTSD scale have a handy abbreviation?
It does.
Okay.
We'll call it the CAPS-5. That's actually what it goes by.
Okay. How common is the use of the MMPI-2 in your profession?
The MMPI-2 is actually the most commonly used assessment worldwide by mental health professionals and in forensic settings for the court.
Why'd you use it?
I used it for that purpose and for its excellent validity in those settings across genders, across ethnicities, for different reasons. And when I keep saying validity, by the way, what I mean is accuracy, and I'll try to work that in, but then also for detecting the accuracy with which a person reports PTSD.
Okay. Is that scaled in some way?
I'm sorry, what was that?
Does that make use of a scale in some way?
The MMPI-2, do you mean specifically for PTSD?
Yes.
There's actually a combination of scales you want to look for. You would never make the diagnosis just based on one scale alone, or even on the test alone. You'd integrate other data.
All right. How did you administer the MMPI-2 to Ms. Hurd?
I provided her the test on an iPad. She essentially had her own little desk area and then an iPad. She hits start, it provides her with the instructions, and then it gives her 567 statements in order. For each one, she taps true or false.
What did you learn about Ms. Hurd from the results of the MMPI-2?
Quite a bit. I wrote up a 25-page interpretation outline. It has numerous scales. So one of the reasons I like this measure so much is that it can tell you so much about multiple different traits and tendencies and mental issues. One of the primary things I learned was that she had a very sophisticated way of minimizing any personal problems. I also learned that she tends to, there were a number of characteristics that were consistent with the eventual diagnoses, but some of the primary characteristics, and I'm going to try to condense 25 pages here, were essentially externalization of blame, tending to have a lot of inner hostility that is attempted to be controlled, a tendency to be very self-righteous, but to also deny that self-righteousness and to judge others critically against these sort of high standards for moral value, but also to deny doing that, essentially to claim that one is very non-judgmental and accepting and yet very full of rage, really. And these aren't facts, but her scores essentially correlated, so they were consistent with other people who obtained these scores who have been shown through many studies to have these very specific traits. So externalization of blame, a lot of inner anger and hostility, sometimes that anger among these groups with similar scores, these people might have that anger kind of explode out at times. They tend to be very passive aggressive. They may be self-indulgent, very self-centered. They could use manipulation tactics to try to get their needs met, very needy of attention, acceptance, approval. They tend to distance people who are close to them. Initially, they may seem very charming. They're very socially sophisticated, actually. That was a major component on there. They have a capacity to kind of offer some of their faults, but in a way, but only the ones that people think of lightly and can all relate to. And so they can present as very fair and balanced, but in actuality, they really might be very judgmental of others and unaware of problems in their behavior and their thinking.
So after you provide the examination via the iPad, what do you do?
So once they've completed the test, you can have it scored by the computer immediately. It's a very complex test to interpret, but right away you get a list of what's called critical items. And these are just a couple of the items, the statements that are presented that are more clearly symptom-based. And I always follow up with the examinee. Some of these might have to do with suicide. Some of them might have to do with other symptoms that you just like to get a little bit more information on, because sometimes an examinee might tell you they're completely fine when you're doing your interview with them and that they have no symptoms. And then when they take the test, it says that they're having trouble sleeping, or they struggle with nausea all the time, or they feel very anxious. And so you want to follow up on that.
Okay. What's a code type?
A code type, let me think of how to explain this very simply. So the main scales, and I keep referring to scales, these are just the main scores that come up on this test. We can refer to them as codes. And when I was saying that Ms. Hurd's scores could be compared to certain groups of people that had been researched before to obtain similar scores, the research has shown that certain people will have certain scores that kind of spike on this, okay? And so all of those traits that I was describing, those are traits that are found in these code types. So it means that score number 2 was high, and score number 6 was high. And so if we have those two scores were both high, then that's a 2-6 code type. And these code types...
What code type was Ms. Heard?
Ms. Heard had the clearest code type was 3-6, but then she also had some other code types that were less significant.
What characteristics are associated with a 3-6 code type?
So a 3-6 code type, a lot of that anger is expressed in this code type. There can be actually a lot of cruelty, usually with people who are less powerful. Actually, when you see this code type, you want to, if you can, to follow up with subordinates, co-workers, people who may have observed their behavior more closely. The 3-6 code type is very concerned with their image, very attention-seeking, very prone to externalizing blame to a point where it's unclear whether they can even admit to themselves that they do have responsibility in certain areas. A lot of suppressed and denied anger, but the anger is very present, will explode out, and a lot of issues in their close relationships.
How does Ms. Heard's code type fit in with your overall opinion as to personality disorders?
Well, this might be an appropriate time to describe a little bit about these personality disorders, because I think what you'll hear is that there's a lot of consistency there. So borderline personality disorder is a disorder of stability. It's instability, and it's instability in personal relationships. It's instability in their emotions. It's instability in their behavior. And it's instability in their sense of self and their identity. And that instability is really driven by this underlying terror of abandonment. So one of the key features also of this disorder, and all of it is like pistons of an engine kind of firing off and igniting one another. But when somebody is afraid of being abandoned by their partner or by anybody else in their environment, and they have this disorder, they'll make desperate attempts to prevent that from happening. And those desperate attempts could be physical aggression, it could be threatening, it could be harming themselves. But these are behaviors that are usually very extreme and very concerning to the people around them. The anger is typically sadly, it's counteractive, right? So the thing these people fear most is being abandoned, but over time, the anger, the explosive anger that they show when somebody is needing space, or when somebody's really not doing anything wrong, because a lot of times they read into things that they perceive as being a slight to them or being somebody intending to harm them that actually isn't happening. They'll exaggerate it, and they'll explode. They'll react in this heightened manner that is just exhausting for their partners. Oftentimes, their partners will try to make them happy at first and really allow themselves to be a punching bag, thinking that they can somehow solve this problem, that somehow they can make this better. And eventually, it just overwhelms them. Histrionic personality disorder is very
Before
similar.
we move on to
Okay.
Doug Stanhope knows her. Stanhope's buddies with Johnny Depp. He knows her. He knows her well. And he's like, she's out of her fucking mind. And I'm like a crazy actress. He's like, yeah, like those are real.
Of course, there's a ton of them.
There's a lot of them.
That's why they're good.
That is why they're good.
Yeah, they're great actresses.
They can just start crying.
Oh, yeah.